Hello everyone, this is video number 2 covering pulmonary ventilation. And so this is the first part of the respiratory physiology. And then there'll be another slide covering gas exchange. And that's what's mostly that's going to involve external respiration, gas exchange in the lungs, with a tiny bit involving gas exchange in the tissues. So what happens in pulmonary ventilation is you're taking air in, inspiration, and pushing air out, expiration. And in order to do that, the size of the thorax and the size of the lungs are going to change. During inspiration, the thorax and the lungs expand, and that sucks air in. During expiration, the thorax and the lungs contract or decrease in volume, and that pushes air out. And basically, pulmonary ventilation is just those changes continuing in cycle. Now, we're going to restrict our conversation to talking about quiet breathing. And in quiet breathing, this is the type of breathing you do while at rest. The expansion and contraction of the thorax and the lungs is relatively moderate. There's also what's called forced breathing. In forced breathing, there's excessive expansion or contraction of the lungs, and this is what happens during activity. So working out, something like that. We're not going to really talk about that in this video, or actually so much at all. So we're talking about quiet breathing. All right, now the changes that occur are going to change the volume of the lungs. And so there's an important principle that's involved called Boyle's gas law. And so I want to start with a discussion of that. And this slide shows the main principles that are involved. First of all, Boyle's gas law describes what happens to the pressure and volume of a closed chamber. And now the lungs are not a closed chamber, but for the purposes of this discussion, we're going to pretend that they are. Boyle's law states the relationship between pressure and volume of a closed chamber. And on the left, it shows that if you increase the volume of a chamber, you're going to decrease the pressure in that chamber. Remember that pressure is a result of the molecules in the air. And these are oxygen, CO2, nitrogen atoms or molecules. And they're bouncing around, and when they bounce into the walls of the chamber, and this would be the walls of your lungs, they're going to create pressure. So if you consider this at a constant temperature and you change the volume, now you're spreading out the molecules, and there's less likelihood that they're going to bump into the walls of the chamber, and so that's going to decrease the pressure. If you decrease the volume of the chamber, now the molecules are squeezed into a smaller space, and that increases the likelihood that they'll bump into the walls of the chamber. That's increasing the pressure. So one of the main principles of Boyle's law states that at constant temperature, the pressure of a gas decreases if the volume of the container increases, and vice versa. In other words, there's an inverse relationship between the pressure and the volume of the chamber. All right, a few other things related to Boyle's law. So this is the same figure from the previous slide, but a few other added points I wanted to make about that. If you compare a chamber in which the volumes differ, one with increased, one with decreased, and you measure the pressure, so you can indicate that on this slide, P1V1 would represent this large volume, low pressure chamber. P2V2 would represent this small volume, high pressure chamber. Then if you multiply the pressure and the volume, P1 times V1, under both conditions, then they're equal. P1 V1 is equal to P2 V2. So Boyle's law states that there's an equality between the multiples of these two variables. And that's just reinforcing the inverse relationship between the two. Increasing the volume decreases the pressure. Decreasing the volume increases the pressure. All right, now how this applies to pulmonary ventilation is, while we're going to be changing the volume of our lungs during breathing, inspiration, increasing the volume, expiration, decreasing the volume. And so what's represented on this slide is gas present in two areas, area A and area B, and they're connected by a set of some kind of connection. And so we're going to this is representing air, area A, air outside the body, atmospheric air, and area B, air in the lungs. Okay? They're connected obviously by the conducting zone, all the tubes between the two. If we increase the volume of one chamber, the lungs, we're going to decrease the pressure in that chamber. So now air pressure inside the lungs, intrapulmonary pressure, is lower than that in the atmosphere. This creates a pressure gradient. And air is going to flow down that pressure gradient. In inspiration, this is what happens. We increase the volume of our lungs, decrease the pressure inside, and we suck air in. Or we can also do this, change the volume of the lungs by decreasing the volume. That increases the pressure, and now the gradient favors air movement out. Okay? So pulmonary ventilation is just continually doing this. Changing the volume, increased, sucking air in, inspiration, changing the volume to decreased, increasing the pressure, pushing air out, expiration. All right, this slide shows the mechanical changes that happen during breathing. How do we change the volume of our thorax and therefore our lungs? Well, we do that through a set of muscles that are going to be acting on the size and shape of the thoracic cavity. There are two main types of muscles that are involved, and they are illustrated on this slide as the external intercostal muscles. So these muscles are on the exterior surface of the rib cage, and they are connecting between neighboring ribs. External intercostal muscles. That's one set, and this is showing it for one pair of ribs, but those would be between all neighboring sets of ribs. Okay? The other main muscle involved is the diaphragm. So if you remember, the base of the lungs are sitting on the surface of the diaphragm. Okay? During inspiration, what happens is both of these muscles contract. Contraction of the diaphragm pulls the floor of the thorax down. And now the thoracic cavity is greater dimension and superior inferior dimension. It's longer, basically, or taller, I guess you could say. Okay? Contraction of the external intercostal muscles are going to pull the rib cage up. And you can think of the ribs connected to the sternum as basically a hoop. When they get pulled up, now the hoop is pretty much parallel to the floor. That's lengthening the rib, the thoracic cavity in the anterior-posterior dimension. Okay? In expiration, what happens is both of these sets of muscles relax. The external intercostal muscles relax, and now the ribs are going to start pointing downward at an angle, and that's going to shorten the thoracic cavity in the anterior-posterior dimension. And when the diaphragm relaxes, the diaphragm assumes a dome shape, and that's going to shorten the thoracic cavity in the superior-inferior dimension. Okay, so here thorax is large volume. Here thorax is small volume. The lungs, being residents of the thoracic cavity, are also going to change in volume. Here large volume, here small volume. Okay, so that's basically what happens during pulmonary ventilation and quiet breathing. This slide is showing basically the same information, but it's representing the thoracic cavity as a cube in which you can measure width, height, and depth. And it's showing during inspiration, you expand the size of this cube in all three dimensions. During expiration, you decrease the volume by decreasing the value of all three dimensions. Vertical changes the height of the cavity and thus the lungs due to contraction of the diaphragm, pulling the floor down. When the diaphragm relaxes, the floor elevates, and thoracic cavity and lungs are shorter. This shows the changes due to contraction of the external intercostals. During inspiration, those muscles contract, and the rib cage actually gets wider and also deeper. During expiration, the external intercostal muscles relax, and the rib cage gets narrower and not as deep. Okay? So the overall point from this is contraction of these two sets of muscles changes the overall dimensions of the thoracic cavity and therefore changes the volume of the lungs. This slide now is tracking what are the changes in pressure that are going to accompany these changes in volume of the lungs. And that's charted on this graph. The two main pressures we're looking at are intrapulmonary pressure, pressure of air inside the lungs, so this would be air inside the alveoli, and the other intrapleural pressure. So this is the pressure inside the pleural cavity, the space between the lungs and the thoracic wall. First of all, this is a chart, and on the x-axis is time as you go through a cycle of quiet breathing. There's an inspiration and an expiration, so over that period of time, we've gone through one cycle. And on the y-axis is pressure. We're setting the intrapulmonary pressure to 0, and that's sort of a baseline pressure. And that's going to change during inspiration and expiration. And relative to that, the intrapleural pressure, you'll note, is always less than the intrapulmonary pressure. The reason for that is from the fact that the lung tissue being highly being contractile tends to want to collapse inward, whereas the thoracic wall wants to expand outward. Okay, so there's a slight vacuum in the pleural cavity. This slight vacuum is indicated by the difference here between the pressure inside the lungs. So this is called the transpulmonary pressure, which is the difference between the intrapulmonary and the intrapleural pressure. Just to track one cycle of breathing, what's happening in the intrapulmonary pressure, when the lungs expand during inspiration, that causes the pressure to drop. It's not a huge drop in pressure, but now this pressure is less than the atmospheric pressure, and that sucks air in. During expiration, the volume of the lungs decreases. They're being squeezed, and that's going to increase the intrapulmonary pressure. Now this is enough of a pressure gradient to force air out. The changes in pressure inside the lungs, intrapulmonary pressure, are also mirrored by the same relatively speaking, changes in pressure inside the pleural cavity. So they're pretty similar. The shape is not exactly the same, but there's always the difference in intrapleural versus intrapulmonary pressure, with the intrapleural pressure being less. This slide is showing basically the same information during quiet inspiration versus quiet expiration. And in quiet inspiration, you're starting with muscles relaxed. When they contract, you pull down the diaphragm, you expand the lungs in all dimensions. So greater volume is going to create a lower pressure. And that pressure gradient here, lower pressure inside the lungs than in the atmosphere, is going to suck air in. Here, after quiet inspiration, the muscles are going to relax. The floor of the diaphragm becomes more dome-shaped. The lungs contract in size, so they squeeze the air, increasing the pressure, creating a slight pressure gradient, pushing air out. All right, this table is a really good summary of the topics I've covered in this video, and it summarizes the status of the muscles, the pressure in the pleural cavity. So this is intrapleural pressure, pressure in the lungs. This is intrapulmonary pressure and the movement of air. In the next video, we're going to talk about gas exchange. This will be mostly about external respiration, gas exchange in the lungs, with a little bit also about gas exchange in the tissues or internal respiration.